You and I think, let's not castrate mentally ill kids, but the way they are framing it is this kid, for whatever reason, has a strong, deeply held personal conviction that they're really a boy and that having these interventions will help them feel more aligned.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here today with Sasha Ayad, who's a licensed professional counselor and works with parents of children who have rapid onset gender dysphoria. She is also co-author of this book, When Kids Say They're Trans, and a contributor to the book, Cynical Therapies. And I am so excited to have you here. So thank you and welcome.
Thank you. Thank you. I'm really glad to be here with you, Ryan.
So start off by telling us just who you are and what your background is.
Yeah, so as you said, I'm, one of the many identities that I wear is that I'm a therapist and I work with adolescents. And I got into this work because I was really interested in human behavior and psychology. Like many people, I wasn't exactly sure what I wanted to do when I was in school, and I found my way eventually to psychology courses and really fell in love. So when it was time for graduate school, of course, I had to decide between more of a research track versus a clinical track, and I really knew I wanted to work with people. So I was a therapist from about 2008 all the way till about 2015 when the gender stuff came on my radar. And basically since 2016, that's been my full-time focus. And as you mentioned, I started to realize very quickly that parents who have a kid who's questioning their identity, especially back in 2016, were very, very lost at sea. And they had only been given this kind of one approach, which is affirm, agree with the gender, let the kid lead the way, or you are a bad person. And in fact, your kid might kill themselves, like this really extreme narrative. So anyway, I can tell you a little bit more about my work, but I've focused on the gender issue exclusively, both helping parents and working with young people in my practice who, I've noticed that when people talk about this from the kind of cultural commentary perspective, the society perspective, it's very easy to kind of focus on the quote ROGD kid and all of their mental health problems and their deficiencies and what they don't understand and how they're short-sighted. But in my practice, I've noticed they're also incredibly smart kids who actually crave like a deeper way of talking about these things. Now, they do tend to be quite sensitive. There's a lot of indoctrination that these kids come into therapy with. But these are really bright young people who are trying to make meaning of a really complicated experience that they're having. And I've really enjoyed working with these kids. It can be challenging at times, but they're really intelligent and really seeking out something more meaningful through therapy.
You hit on something that just, it really shocks me. It's like a hostage situation right away. Do you want a dead son or a live daughter? If you don't act right now, they're going to commit suicide. This is like really, it really ups the ante very quickly right
Yeah.
out of the gate, to where it's like emotional manipulation.
Yeah. And I have to say, what often happens in these cases, and at this point, I did a tally a couple months ago. I've talked to nearly 1,000 families since 2016, many of whom follow up with me. And not that they've been individuals on my caseload, but through my consulting practice. And something that I've really come to observe is that most of the time, when a parent hears this live son or dead daughter threat, I call it a threat because I do think it's a manipulation. There's usually been a series of really destabilizing events in this family's life where the child was maybe dealing with some really complicated mental health issues. Maybe they were severely depressed. Maybe there were some instances of cutting or even a suicide attempt. And then the gender thing lands in this family's lap and they hear this threat. And I think some parents immediately go, what are you talking about? That's absolute BS. Like, my kid is not going to kill themselves. They've never said anything like that. So some families don't really buy it, so to speak. But I've seen that a lot of families who were already in crisis, they're so disoriented already that that threat seems very credible. Maybe their kid literally is really, really depressed. And so they are very vulnerable to having their emotions manipulated because they're understandably terrified and willing to do anything and everything they can to save their child. So that's when I think families become very vulnerable to this pressure to affirm, even if in their gut they're like, something about this doesn't feel right. But you know what? I've been confused for the last 6 months because my kid is falling apart and I didn't know what to do then. Maybe now I just need to trust the doctors. Like, they are saying this with an air of authority and a lot of certainty, like, this is what you do and this is what's going on with your child, and they have gender dysphoria. And so a lot of families come to the table already vulnerable and destabilized and confused. And so I've worked with lots of parents who a year into affirmation realize things aren't going well, or they realize that medicine is impending, and they go like, "Oh shit, like what have we done? We're here a year into this affirmation and now we want to change course." So I really feel for those families because they are really being taken advantage of in a way. And I think there may be some doctors who are well meaning, but nonetheless, we know that the data doesn't stack up and that this is really a dangerous pathway to take.
Yeah, I mean, wow, that was so much good stuff. And I spent a number of years as a very radical lefty, and I felt like I don't know if all of my motives were good, but certainly some of my motives were good. It's like I had some gay friends who were bullied. Like I don't want, that path for other people. I want to prevent that. And then I'm told this trans issue, it's just the next version of that gay rights thing that you were standing up for,
Yeah.
Trans rights are human rights. You want to be on the right side of history. The science is settled. The medical research is very clear on this. This is what you're told. If that's all it seems like a no-brainer.
Yeah. And it's interesting that you brought that up because in some of the interviews I've listened of yours, you mentioned often in passing that when you got into radical leftist political ideas, you had yourself just been coming out of something. I can't remember if it was like substance abuse or depression or something. Okay. And so you really wanted to put your energy behind something that you thought was meaningful and could potentially change the world for the better. Now, of course, we always, as humans, have to be aware of the dark motivators as well as the positive ones. Like, we also maybe want to control others, or we want to like stick it to like have a blame figure, so to speak. So I think it's interesting that you raised that because, yes, in addition to all the misinformation, the kind of conviction behind these ideas is really, really powerful. And it's it's really a disservice, of course, to the patients when people have this black and white narrative. And you brought up the question of like, is this the same thing as supporting gay rights? I mean, this is really, and I think I heard you say this, like it's framed like the most important civil rights issue. And I think in a way, what's so interesting is like the more absurd the claim, the better a litmus test it becomes for who the true believers
Mm.
are. Like, if
Ooh,
you think about how nuts it is, we're going to chop genitals off of kids. And if you believe it, then it shows us how much of like, you're willing to put your faith behind even the craziest thing. That's why I think this is almost such a religious movement. It's so crazy. But there's like, it's really hard to rationalize it if you just take a bird's eye view and think about, okay, what are we doing here? And I think it's a kind of litmus test of some sort. And I can't flush this out fully, but I really have come to believe that.
that is so brilliant. This idea that the more ridiculous it is, the more proof it is how devoted you are to the cause.
Hmm.
I don't know if you know Eric Hoffer's The True Believer. He's
No.
an American philosopher, like mid 20th century, and he writes
Okay.
about this kind of like the basic psychology of a communist and a fascist, like a religious fanatic. Like they're all kind of the same core psychology. And I love this idea because anybody can just generically say like human rights matter. But if you say, I believe in castrating mentally ill kids, like you are really putting it out there. Like
Yeah.
you're really showing like I am devoted to this cause so much so that I'm going to say this seemingly ridiculous thing.
Hmm. Hmm. Yeah. And I feel like, and I've heard Helen Joyce talk about this. It's the adults who put their energy behind something like this have the most to lose because if you start to, I hate to say admit defeat because it's not per se a battle. I mean, I think it's really an ethical and moral dilemma. But if you start to allow cracks into your thought process, you have very, very high stakes there because you supported this practice, which amazingly, the rhetoric around it really demonstrates this. It's either life-saving, medically necessary care that is required for a child to be their authentic self. Like, whoa, talk about hyperbole. Or, I mean, and I agree with this very much, but I think it's interesting to observe again from a bird's eye view, or it is butchering and chemically castrating. So, you look at that rhetoric and you're like, wow, the stakes are high for everybody involved here.
Now, what you said just like sparked something in me because I feel like I mean we're aware of recent developments, all the big reviews coming out of Scandinavia, the CAS report in the UK. We know about the WPATH files, right?
Mhm.
The evidence is not going well if that's your ideology. Is there some kind of pathway out of it? It feels like there's no pathway. You have to double down. It feels like there's no pathway other than I supported like butchery and barbarism. Does that make sense?
Yeah, yeah, totally. Well, I think this is really interesting because, um, you know, I also am from the perspective that there are going to be people, of course, I think once we have some time and space away from this, what I think is a medical scandal, a lot of things will become more clear. And when you're in the thick of something, you can't always see what the heck is going on around you. So I suspect, like, in 100 years, I don't really think this is going to be happening on such a massive scale. And so we may look back and have clarity about it. But I have to say, there are lots of ways that people can live and lots of ways people can construct a narrative to make sense of what they've been through. So inevitably, there are going to be people who medicalize their children, and there's going to be adults who were medicalized as children. And they may not see it as, oh crap, I have to double down. What they're going to see is they're going to weave a narrative thread throughout their whole life, which reinforces this story that, like, I'm a special kind of person. I am a trans person. In order to be myself, I had to have these interventions. And the medical trade offs that I've been forced to make, such as like health consequences, maybe shortening my lifespan, all of these really complicated, side effects, they are part of my beautiful, righteous struggle to be authentic. Like, human beings can do amazingly unusual things across time space. I mean, just think about human history, the kinds of crazy things humans have lived through before we even had, medicine and technologies. And I mean, we've been through crazy things. We are an adaptable, bizarre species. So I don't think that everybody is going to have this massive wake up call. I think many people will. And we see huge numbers of people detransitioning and going, oh my God, what was done to me? And also, what did I collude in doing to myself? Even if you were somewhat young, people who seek these procedures out oftentimes want them quite desperately. Not always. I mean, I also do some expert witness work, and I've seen how incredibly vulnerable a teenager can be sitting in the therapist's office with questions about their identity. And you see how the therapist's responses can push them in one direction or another. So I say all this to say, I don't think it's going to be a clean exit out of this scandal. I think there will always be true believers, so to speak. And it's not the same thing because I don't think the medical interventions associated were nearly the same. But we saw stuff like this with multiple personalities and, the whole like DID communities that are cropping up now. And every now and then I will say something on, in some of my material about trauma, right? Because there's all of this mythology around trauma, capital T trauma. And there are people who think everything is trauma and that trauma is destructive in your nervous system, this and that. And every now and then I'll say something about this, and somebody in a comment will say, but actually, no, trauma really does get trapped in the body and this and that stuff. So, even when we have really solid evidence about stuff, there will always be people who have woven a narrative around this belief system that gives their life meaning or whatever, or it's a coping mechanism or whatever. So I don't think anyone's gonna, like, not that many people I think are gonna admit defeat on this. I think they're just gonna reconstruct their narrative and move right along, if that makes sense.
There were so many directions I want to go with all, all what you just said.
Okay.
One is culpability of therapists. One is culpability of social media. One is what you think of the body keeps score, but here's one that I want to throw at you,
Okay,
like, before
okay,
we get
okay.
any of these.
How much
I
time do we have here,
I don't know.
Ryan?
It depends on what your schedule is. I schedule an hour, but if you can go longer, I'd love that.
Yeah, yeah, okay, let's do it.
Okay, so I don't want to be too cynical, and I don't want to be too accusatory. So tell me if
Yeah,
I'm like
yeah.
overstepping my bounds here.
Okay.
Munchausen syndrome by proxy.
Mhm.
Do you see that with these ROGD parents where it's like there's some degree of social capital from having a trans kid?
Okay. Yeah. Okay. So I think, first of all, there's a sample bias that I have because I've been so explicit in my position on this that people who contact me, I would say 99% of the time, are having that oh shit moment, as I call it, and trying to get their kid out of this. Okay. So that's my sample bias. So I'm not talking with those parents, but I think everything is possible. I'm a therapist. I have to believe every constellation of personality is possible. Are there parents who are oriented towards some sort of a Munchausen by proxy situation and gender just happened to be like the mode in 2025? Of course, of course. And there are lots of therapists putting an immense amount of pressure on parents to affirm. And I think even the most brilliant therapists, and I wonder if you've found this too, if you are a therapist these days and you have not found your way to this kind of, for lack of a better phrase, like anti woke perspective, and you haven't looked into the gender thing, and you otherwise still consider yourself a pretty good liberal, and you don't know about the Path scandal and cast review, and you don't know about gay kids getting trans, if you don't know any of that stuff, most therapists are tongue tied. They're terrified of challenging a kid's identity. And, I just talked with a mom the other day, and she told me when she took her kid to a therapist, the mom was like, my daughter's dealing with this or that thing. I really want you to help her explore it. Like, how do you deal with gender? And the therapist kept repeating the phrase, we are trained to affirm. We are trained to affirm. And
A
she was like,
robot.
it was like surreal and terrifying. I mean, it's like dystopian hellscape. Like, what are you talking about? We are trained to affirm. So I think there are Munchausen's parents. And also, you take a somewhat normal parent and you put them in that situation. And if they don't know any better and they haven't started digging into this and their instincts are already all jumbled up, you can have a Munchausen-like appearance in a situation that maybe isn't quite that, if that makes sense.
Yes, yes, it does. I want to get into this. We are trained to affirm. What is the culpability of therapists? 'Cause, I mean, let me step back 1 second and
Okay,
say, like,
okay.
there are some ambiguous issues with wokeness. Like critical race theory is kind of complicated, and DEI training kind of stuff. Like most of the time, it's just kind of annoying, you know. But if you can't take a stand on don't castrate mentally ill kids, it's like there is no better litmus test than that. I mean, if that's not your breaking point, I don't think you have a breaking point.
Well, I don't think that's how people think about it. You and I think let's not castrate mentally ill kids, but the way they are framing it is this kid, for whatever reason, has a strong, deeply held personal conviction that they're really a boy and that having these interventions will help them feel more aligned. It's a long way of saying it, but that is a very different orientation to the problem than this kid is mentally ill and wants to chop off her boobs and will likely regret it in 5 years. I mean, those are two totally different worlds. So I always try, something I've really tried to do in my work is try and understand how the heck did we get here? How is it that so many therapists are willing to say, we are trained to affirm? Like, it's so creepy, right? But like, there's a reason why. And I think it's because the way you formulate the gender dysphoria problem will completely determine how you think about it and how you treat it. And so, if you come from this social justice orientation, then these are not mentally ill kids. These are kids who, because they are trans, have been oppressed and are suffering and they're misunderstood, and that we need to let them teach us. Like, if you go to a WPATH conference, like, it's absolutely a shit show, but that's the basic orientation is like anyone who claims to be trans has something to teach you, the therapist. So you better just listen, take all of your biases, which might just be normal critical thinking skills, take all your biases, throw them out the window, and let your patient teach you. I think there's like, we really have to understand the mindset of a person who believes that this intervention could be beneficial.
Yeah, there's something about this issue that's like, here's other issues that require evidence and like scientifically backed methods. And then there's like this holy and sacred trans issue, and it's like you would never tell an 80-pound anorexic who believes she's obese, yes, you're obese. You don't affirm like a lot of things you don't affirm, but this issue is like a completely different category.
Yeah. Well, I mean, I think it's so tricky because I hate to say that this is a slippery slope issue, but I do think once we start thinking about the evolution in societal approaches to gender and sex in general, like the diminishment of the differences between men and women has been in the works for some time. Like that there really aren't any differences between us. Now, there are certain areas where I think we should insist there shouldn't be differences, like everybody should have the same level of dignity. Everybody should be allowed to kind of meet their max capacity and whatever interests them, whatever. But I mean, when you start saying that, for example, like, oh, I'm getting into tricky territory, but like if you start saying, for example, that both men and women could be equally great firefighters. Okay, let's just say, because I think in the early 2000s, that would have been an argument that is a mainstream argument that people would be making, like feminists might be making this argument. Well, I mean, soon enough, you might say, well, what is gender at all? Like, if there are no gender roles, then are there really differences between males and females? And then if you get into that space, I think people start to go, well, what makes me a woman? Maybe I've never thought about it. If you look at, it's often called gender ideology. I don't know if I love that phrase, but the identity beliefs that are often part and parcel with all this trans stuff is like, we all have this internal sense of gender inside. And if you've never noticed it, it's because yours is aligned. Congratulations, you're cis, but like if you're trans, you would have noticed the difference. Well, how much noticing? I don't know. Like sometimes when I'm at the mechanic, I feel a little bit weird about being a woman. Does that make me trans? Like all of these little threads that they start to pull apart. So, I mean, I raise all this because I think there are therapists who genuinely feel so baffled by this that they're like, maybe there is a person trapped inside another person. Like, I have rejected that idea, but I've been thinking about it carefully for like almost 10 years. But some people who are on the outskirts of this, they go, I don't know what it means to be trans. I mean, I'm not trans, so how would I know? And then I think once you start pulling on that thread, you get to the point where you're like, these people are not understandable to me. Like there's an exceptionalism, which goes to your point about like other things require evidence, but trans does not. Well, it's complicated because it's totally subjective. How can you ask for evidence that you actually feel like a man, Ryan? Like, I can't ask you for evidence. Like, that's up to you. You tell me, do you feel like a man? So, I mean, you and I have examined these ideas. So I presume that there are lots of moments where you're like, you know what? That's bullshit. I don't know what it means to feel like a man. I'm a human being. I have multiple emotions. I have a personality. So, like, we've actively rejected these ideas. But if you haven't thought about these ideas and actively rejected them, I think a lot of people are just like, I don't know what the hell this is about, I guess. Like, if that person says they're really a man, I guess they're a man. Like, I've seen that enough. And like, I don't want to pick on this, but this is an amazing thing. My previous co-host from Gender A Wider Lens, Stella O'Malley, she has this new podcast with Mia Hughes, who's the author of the W Path Files, and Brett
Yes.
Alderman, who's like brilliant psychologist. And they recently interviewed Alan Francis. Do you know who Alan Francis
That
is?
sounds familiar.
He's like one of the pioneers of the DSM.
He wrote the book Saving Normal?
Saving Normal.
Yes,
Yeah.
yes, yeah.
So I haven't watched the whole interview yet, but I've seen a few
I saw a
clips.
clip. Yeah.
Well, it blew my mind because Alan Francis is one of the most knowledgeable people about why we should be critical of DSM diagnoses.
Yeah, and
okay?
sober-minded.
Very. I mean,
Yeah.
he is just like the OG of clear thinking on psychiatry. but they're asking him about gender, and you could see him absolutely fumbling these questions because he was like, "Well, some of these kids will benefit from the interventions and some won't, and to be honest, this is really confusing and I feel confused about it and I don't know." So that's what I'm saying. Like, if a person hasn't looked into this gender stuff deeply and hasn't realized that the whole medical thing is like totally subjective and arbitrary and it's not based on evidence, you will end up like Alan Francis, who's one of the most brilliant and intelligent, knowledgeable people, who still is like, I don't want to say it's bad to cut off kids' body parts. I don't think it's okay to say that. Like, that's what I'm trying to say.
Gosh, there's every time you speak, and this is such a wonderful conversation, but every time you speak, there's like 10 different directions I want to go. So I'm trying to keep all my, no, it's wonderful. You talk about the guy, he chaired the DSM-4 committee. I mean, you look everywhere, psychiatrists, therapists, medical researchers, people at Harvard, Yale, Princeton, the smartest people on the planet got duped by this. How did that happen? For us in 2025, it's like, okay, we can kind of look down on that and judge it, but like how? I don't understand.
Well, I think it's because of this sense of exceptionalism, and I'm borrowing that term. Stella has said that many times on the podcast. I think it's a really good explainer. If you look at the history of gender medicine, it has always had a flavor of patients who really, really want an intervention driving the changes in the field and how the interventions are distributed. So, for example, like back in the day, there was this like 2-year test where a person had to live in their preferred gender for 2 years. They had to have a job in their, in their new gender presentation, do all this stuff. And there was much more of a process that was slow and also required people to really prove that this is authentic for them. And a lot of patients hated that. I'm sure some patients thought it was a good practice. Like, there's always a variety of responses, right? But there have always been people that have felt like that is condescending or judgmental or whatever, you know? So I think over the years, more and more trans identified people have had a say in what gender medicine is. And as therapists have taken a more of a customer satisfaction approach.
Customer's always right.
That's right. And, like we're supposed to, with all of this like mental health advocacy where like all of these groups of people pop up and advocate for their demands, like we're the Bipolar Organization of America and we demand this and that. Like, this is happening outside of gender too. Therapists have really like, for, I won't say for better or worse, but like they've really given their sense of discernment and wisdom and clinical knowledge up to the patient groups. And that's happened much more with gender than anything else, because when a mental health diagnosis also becomes an identity and a lifestyle and a culturally salient way of living, and like this super prideful, like, drag queen happy hour, like this has become like a really cool thing in certain circles of society. A lot of therapists, I think, very much like an Alan Francis, are like, I don't know what that is like. Who am I to say who's a real woman and who's not a real woman? Like, I think it's very much that. And, I try to be, I try to understand why this has happened. But I do think like we cannot give up all of our thinking and just hand it over. And also, to be honest, I think in a kind of ironic way, like if you have a curious perspective, the more patients you meet who are trans identified, the more you realize, first of all, this isn't just one thing at all. These people are all very, very, very different. And sometimes this transition pathway works out well, and sometimes it does not. If you, like, as a clinician, if you can have a neutral perspective and not be scared to work with patients, you'll start to realize what's really going on. But I think therapists in this world tend to be either they're gender affirming, so they have like this worldview, a philosophy about it, or they're too scared to touch it with a 10-foot pole. And so they never get the kind of boots on the ground experience with patients. And so you have like a vacuum of knowledge almost, if that makes sense.
Yeah. I had a Laura Becker on the podcast,
Yeah.
detransitioner.
Yeah.
And the way she described like her experience with therapists and the medical profession, she's dealing with trauma and this mental anguish and chaos and emotion dysregulation, all this stuff. And it sounded just like these vultures were like preying on her. I think at one point she said mercenaries.
Mm,
How much
mhm,
kind of get into
mhm.
like the culpability of this whole industry around this?
Yeah, it's really sad, and in my expert witness work, I've really seen that. It is so it is such a devastating betrayal of your patient to do that. And I think in my opinion, this can be tied in, which I think is why you're doing this podcast yourself, like tied in with the broader social justice worldview that has become such a part of therapy. And it really makes it impossible for the therapist to see clearly. And with gender, I think therapists are either, I mean, I hate to say this because I'm not trying to like be self-aggrandizing, but I think sometimes some therapists are just not that intelligent. I have to say, there are lots of
You said it, not
therapists
me.
out there. I know, and it's fair, and it's fine. Like I'll just say it. I've met lots of people, gender or not, who have told me about like their experiences in therapy, and I'm like, that's so underwhelming. I don't know. So I think sometimes therapists are not necessarily thinking very much for themselves. Maybe they don't have a lot of clarity on these ideas, and they're following like a manualized protocol. And so in a way, I think they should be held accountable because, well, this is another really important thing, and maybe we'll tie this in. Gender transition procedures are very unusual in that society has not figured out how to categorize them yet. Okay, because on one hand, I would argue these are equivalent to cosmetic procedures. It is changing the aesthetics of your appearance in order to look different. Okay, but the way we are treating them in the medical world, in the therapy world, is that they are like a medically necessary procedure that insurance is going to cover. And in order for insurance to cover it, you have to go through almost this checklist. So therapists are in a super weird position in that when you want a letter for mastectomy, for example, let's say you're a girl who identifies as a boy and you want to get your breast removed. In order to go to a surgeon and have that done, unlike a cosmetic procedure that if you want a breast enhancement, you just go straight to the surgeon and do it. For this, you have to get a letter from a therapist. So the therapist is this bizarre gatekeeper who is making recommendations about medical interventions, even though they're not a physician. And they're also told that they have to use this affirmation protocol where like every patient gets what they want. So it's like a super bizarre situation to be in. And so I think from that perspective, therapists absolutely should be held accountable because the therapist is the person who's green lighting this entire medical process, which is weird. Like, I can't think of any other situation as a therapist where a person would come to me and say, hey, I want a nose job. Can you write a letter saying that I should get one? Or like, I want a divorce. Can you sign this document saying that I'm in the right mind to get a divorce? Like, there's no other situation where we're asked to write off on stuff like that, right?
Yeah, I'm going to butcher this term. I'm sure you know what I'm talking about. But it's a form of body integrity identity disorder, omnatomnophilia. I don't know if you can.
Apotemnophilia, I'm
Yes,
pretty
yes.
sure is how it's said.
Yeah. So
Yeah.
if I go to a doctor or a therapist, I say this arm, I don't identify with this arm. This arm doesn't really belong to me. I would like a surgeon to remove it. There is no place where that would be taken seriously. That is a mental disorder. You need psychotherapy. But if instead of arm you said genitals, all of a sudden we put this into a different category. Right. Again, this comes back to like this issue is holy and sacred and it can't be held to the same standards of evidence.
Yeah. Yeah, it's really crazy and interesting, and I mean, that's why my perspective is that I think this should really be treated like a cosmetic procedure, and it should be I think, like, if people are grounded in a realistic understanding of this, everyone will be better off. Now, for children, it's a totally different question, but, you raise the apotemnophilia thing, and to be honest, I mean, I can't remember if we covered this in the podcast, but it's crazy, but I could imagine a world Especially like right now, if you think about it, Ryan, like there are so many ways that medical technology has become so ubiquitous in our day-to-day lives. Like people are microdosing on like psilocybin just to like have a better creative process. And we all have these like Bluetooth things in our ears 24/7. And God knows when we're going to have like contact lenses that show us the Amazon prices of shit. It's only a matter of time before technology just impedes our lives so much. And if that's the case, and this identity medicine thing grows, I could totally imagine a world where lots of people are like, I elected to amputate my arm and I'm so happy as like a stump haver. Like, I could see that as a legit thing. I don't put it past human beings. Now, is it a good idea? I don't think so. Should we examine the ethical dilemmas around this? Absolutely. But to me, like the thread between gender transition and having somebody elect to be an amputee, it's not that big of a stretch. And so I mean, not saying whether we should or shouldn't do this. I'm just saying, like, it's not that far away. You're right. It's shocking at this point in time, but I don't think it's impossible for that to become much more normalized. I follow a guy on Instagram who had a leg lengthening procedure. He's this bodybuilder guy, obviously with body dysmorphic disorder, in my opinion. And he had this very unusual, rare surgery to lengthen his shins by a foot or something. And he's been in recovery now for years. The guy just did his first squat like 2 years into his recovery. Like, it's crazy, but I just think if human beings are so fixated on a certain aesthetic outcome, you can make yourself absolutely neurotic with things. And I could see how somebody might get obsessed with being an amputee. Like, I can just see it happening, and it doesn't seem that I mean, it's
Oh,
crazy, but it
yeah.
doesn't seem that crazy compared to some other stuff people do.
That's true. That's true. I want to shift gears a little bit. I don't know if you have anything to say on this topic, but non-binary gender identities. Because if
Have
you
you met me? I have a lot to say on every topic. Lots to
so
say.
if you have like a binary transgender person, I'm a man, I
Okay.
feel like a woman, I want cosmetic surgery to make me look like a woman, we can say that's medically and psychologically unsound, but we kind of have a good conception of what we're talking about. Once you remove it from that binary, you lose all kinds of footing. So there's people on like Tumblr or non-binary wiki. There's hundreds and hundreds of these gender identities. A gender tied to anxiety or the forest or demons. There's people identifying as aliens, cartoon characters, wolves, dragons. Do you see any of this in your practice? How do you conceptualize like treating like these type of identities?
Well, I always say behind these novel gender identities, people are trying to solve a problem or meet a need. And I think there's a metaphor in here that we are missing when we get too focused on the literal manifestations of this. Okay. So the metaphor, I think, is, sometimes I just don't really feel like I fit in with women or men 100%. I'm trying to figure out what that makes me. I don't know if this means I'm still a woman. And I don't really think I'm a man exactly because I'm looking at you, Ryan, and I'm like, I don't think I'm the same thing as Ryan. But I want to understand this better, and I want to be able to stake something in the ground so that I can stop searching. Like, I think a lot of people are lost. They're searching for something. They're trying to understand experiences that they've had. And frankly, if we were having this conversation in 1972, like, there were no concepts of non-binary gender. So anyone who had that very common experience of not fitting in fully here or here, they wouldn't have really given it a second or third thought. They just would have been like, I guess I don't fit in. Like I'm an outsider or I'm eccentric or like they would have just slapped a different label on it. But if you have that experience now and you're a Gen Z kid who literally grew up on the internet and every time you create an app on a gaming platform or whatever, you're asked your identity, you're all of a sudden having to like put labels on every minutia of human experience. So I always try to understand, like with each individual patient, I really try to get to know them and figure out what is the problem you're trying to solve here? what is the metaphor that you're missing by being so literal? So, like, this is what I kind of hate about gender medicine. If you take this quote non-binary identity, I know there's thousands of identities, but let's just take this one. When a person says, like, I'm neither male nor female, or maybe even they say, I'm both male and female. Gender medicine in its absolute idiocy will say, okay, well, perfect. Let's give you a touch of testosterone and like give you some breasts.
Do they really do
Like,
that?
yeah, like Diane Ehrensaft, who is like one of the pioneers of this concept of the trans kid, like she has a paper advocating for, letting non-binary patients choose the medical pathway that best expresses their gender, which is a little bit of both or a either or. And there's surgeons who do phallus preserving vaginoplasty, i.e., keep your dick and get a vagina. Like, this is a thing. Now, these are the fringes, but it's interesting to explore them because this really tells us where do things go when we take these ideas to the furthest extremities. So to me, I'm like, okay, kids are playing around with identities. Like when I was a kid, I used to read the like, which Friends character are you quiz, and I would take it, but I didn't then go to the doctor and say, turn me into Rachel or
Yeah.
whatever. So I think it's normal for kids to be experimenting with kind of kooky, weird identities, but it's a different thing for the adults and the doctors to be like, okay, let's make that for real and forever for you, you know?
I mean, if you uproot yourself from reality, there's no good reason that you shouldn't have a penis and a vagina at the same time, you
That's right.
know?
Yeah.
Yeah, you kind of like led us into this idea of social media and how much blame goes on social media because it seems like one thing I see is kids on the spectrum or just any kind of kid that has trouble fitting in socially, you dip one toe into this
Hmm.
trans water and you get love bombed. And so there's like that reinforcement. You think, okay, I'm going to keep going. How do you see social media reinforcing that?
Yeah. I mean, it's 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 social media because, well, there's a couple of reasons. It's a cyclical problem. If you struggle to get along with kids IRL and you find that these text-based online platforms where you can turn the computer off when you're having a hard time or just close the window if you don't like it, are a much easier place to kind of manage your social interactions. So it becomes maybe your like only place of managing social interactions. And this is already hard for kids on the spectrum, but all of the human cues that we use to interact with each other, which get diminished on a screen, but still are better than a text-based thing, they are gone. And so text-based interactions become about what's the right thing to say and the wrong thing to say. It's like, what are acceptable ideas here or not acceptable ideas? And you can even gauge whether or not something is good or bad based on how many likes or retweets or whatever you get. So it's a very clear feedback system for a kid who's on the spectrum who doesn't really understand social interactions. But in the online world, you can very quickly figure out what you're supposed to do and not supposed to do. So I think for some kids, it provides clarity. But of course, the downside of that is you're also being molded and manipulated to think a certain way, talk a certain way, express certain ideas, and to disavow other ideas. So social media is a really easy place to get sucked into like cult-like thinking. And, I don't know if you've experienced this, but because of the work I do and how my perspective is just out there, when I talk to people in real life and I talk about what I do, they might agree with me wholeheartedly or really think that this is valuable to think this way. But online, they would never say that. People are very guarded. And I'm talking about people in our generation, but it's even harder when you're a kid, right? So I just think the social media world just can easily suck you into a vortex of ideological thinking and rigidity. And frankly, it's hard because even in three dimensions, like some of these LGBT school groups and like the health ed curricula are full of this gender nonsense too. I mean, social media plays a big role. Something I always talk with parents about is like, you have to remember that human attachment relationships can compete with each other. So if you have a really close relationship with your 11-year-old child and you know that it's close because They seek out your company all the time. They want to please you. They ask your opinions about stuff. You have fun together, like you feel connected. If your 11-year-old child starts building some sort of online network with people who are in a competition for your attachment, all of those like emotional needs that they were meeting through mom can get diverted into this online group. Now, of course, it's not healthy, but parents will often see that, especially parents of ROGD kids will say, we were incredibly close, but I noticed like that summer when COVID happened and my kid was online all the time, he started getting really distant. He stopped coming down to dinner with us and he started being really grumpy for no reason. And it's because there's a competing attachment problem that you have. And so even though, parents think, well, my kid is safe in their room. Yeah, well, their mind and their heart is not safe on that computer if this is substituting like real life healthy attachment.
Wow, you use the word cult, and I want you to flesh that word out a little bit. I definitely see like the social justice movement generally as a religion, and I think in that regard, there's people like any religion, there's people who are going to kill and die for the faith, and there's people like Christians who show up on Christmas and Easter, if that makes
Yeah.
sense.
Yes.
And there's even atheists who will say God bless you, because that's just kind of what we do
Right.
here.
Oh yeah. Oh, I
There's
love
people
that.
who put their pronouns in their bio because that's just what we do here. In my university, every single professor has a Progress Pride flag outside their office.
Mm,
Every single one. And it's like,
mhm.
I don't know if everybody believes in it that deeply, but that's what we do here. And I'm wondering
Yeah.
if you could flesh out this kind of religious or even cultish component of the trans movement.
Yeah, I think you raised such a good point, and I remember early on when I was doing this work, there was a kid on my caseload that I was super, super worried about medicalizing, and at the time, I had made contact with somebody who is a cult expert, like, he was a former cult member, and he now helps people help their families who are in cults, and I was on the phone with him, and I was just so worried, and I was like, "I don't know if this kid is gonna transition," and he said something like, we all interact with groups differently. And he raised the exact same point that you just said, which is like some people are like martyrs and they will die for their religion and they will like suicide bomb themselves. And other people are like casual attenders who have very healthy and normal lives. So I just love that you raised that because that's really helped me understand this. I think that when you are vulnerable, are you're a teenager, you are lonely, you are so desperate and primed to go all in with something. And I think that is the trick because these gender identity beliefs are self-reinforcing. They're also isolationist in that a lot of kids believe anybody who's not with us 100% is against us. And so it really sets up a dynamic where you become more and more limited in like who you're allowed to interact with and how you can interact with the world and with yourself. So I think in that way, gender identity beliefs can be very, very cult like. And, I think if you go looking for examples, you can see like some of these just extreme, the chanting, the trans women are women, and like the bizarre. There was an interview on Trevor Noah with this male to female trans athlete slash philosopher Veronica Ivy. And oh my God, I think you probably know what I'm talking about. Like this person says, well, I am a biological human being and I'm made of biological material, blood, tissue, flesh, and my driver's license says female. So that means I'm a biological female. And I was like, wow. I mean, that is almost like how, I don't know what your religious beliefs are, but how like, who are those Christians who try to like prove that God exists using like sciency? Like, what are they called? Do you know what I'm talking
Intelligent
about?
design?
I guess. I mean, it was almost like that. I mean, it's called not apologetics. It's something like that. I can't remember the name of
Creationist?
it. No, I'll think of
Okay.
it and I'll
You know,
text you or something.
when you talk about the cultish thing, there was Jordan Peterson was getting protested at one of his speeches, and they're shutting him down by what struck me is like people like that get protested all the time, so that's not that big of a deal. It was how they were chanting. It was like this
Mm,
rhythmic chanting. They were saying, transphobic piece of shit, transphobic, and they're saying it over and over, like, and it's like
Yeah,
the whole
yeah.
crowd is lulled into this like mass hysteria, like a hypnotic trance in a sense. It's just wild.
Yeah. Yeah, no, I mean, I think it's like that's why I think it's really important to remember that we are all, I mean, as human beings, this is in our nature. That's why when you go to a concert, it's so moving and we can all be transported and we're singing alongside with everybody with this music. I mean, we're all, I don't want to say vulnerable because it's not necessarily a bad thing, but we all get swept up into things without fully being aware of what's going on. And I think you just have to be really careful about like, well, what do you stand for? Like, what does this movement stand for? And it's, claims to be about unity and peace. And I'm sure for some people, like the casual churchgoer or whatever, it is truly about that for them. There are probably lots of people in the proclaimed queer community or trans-identified people who are like, I would never like shout down an old lady at a protest. But then, on the extreme edges, we've seen it's all the years of work that I've been doing this, I've seen lots of really egregious versions of this movement. So, I think it depends on how people interact with it. But I do want to say any belief system or worldview that is completely divorced from reality, you are going to have problems. If the trans movement said something like, I recognize that I am, a biological female, but I would prefer to be seen as a man in society. So I'm going to change some of my appearance. But, I know who I am and my mom knows who I am, but I prefer to be seen as a masculine entity. That is not divorced from reality. But what the trans movement does is if I say I'm a man, I'm literally a man. And there's no right or wrong way to be a man. So it doesn't matter if I look like this and you have a beard because that's transphobic. Like it's divorced from reality. So if you have a worldview that's divorced from reality, of course you're going to have, it's going to attract people who are distressed and confused about the world and who themselves are not grounded, or it's going to take people who were in a healthy place and make them ungrounded. I mean, I can't tell you how many times in this, all these years I've seen a therapist who is a gender affirming therapist and they're presenting, congruent with their birth sex, like they call themselves a cis person. And if I follow up with them 5 years later, oh, surprise, surprise, they're trans now, they're non binary now. So it's like, if you are not tethered to biological reality and to the fact that there is capital T truth in the first place, you're going to run into problems and you will be so susceptible to just like getting untethered from
Right.
reality, I guess.
Yeah, it feels like I don't know the exact timeline. You might know it better, but there's like, okay, I'm a man, but maybe on the weekend I want to do drag. I'm a man, but I want to dress as a woman. I'm a man, but I want to live my life as a woman. Okay, I don't really know what that means, but still okay. I am literally a woman, and if you don't affirm that, I'm going to attack you. It's
Yeah.
like, whoa, that
Yeah.
was a huge jump right there.
Yeah. Yeah. Yeah, I mean, I think it's so tricky. This also kind of dips us into the question of autogynephilia, which like is a whole other can of worms, which might be interesting, but I think that trajectory happens on a micro scale, sometimes with individual MTFs who decide to transition. I've heard many stories where it started out exactly like that. Like, I'm so confident in my masculinity, I just like silk floral shirts. Okay, no big deal. That's cool. Like, you're creative, eccentric, love it. And then that slowly, gradually turns into something different. So, there's obviously some people for whom that is a growing sexual proclivity. I mean, autogynephilia, like the idea of a man being attracted to himself as a woman. But I do think the framework of gender identity beliefs is very literal. Again, they lost the metaphor in all of this. It's a very literal perspective. And I remember when we talked to Dr. Az Hakim from the UK, he said something very insightful, which is when you take an autistic mindset and you put queer theory into it, they almost take Judith Butler as like an instruction manual. So it's like, these queer theory ideas, if we are to be generous, I mean, I think they're BS, but if we're to be generous, queer theory ideas are meant to be thought experiments. They're supposed to provoke us to kind of question why things are, how our perceptions are, but they're not supposed to be like an instruction manual for life. So, I do think there's something about neurodivergence, which is highly represented in trans identified people, and this very literal interpretation of these ideas that maybe lends us to this bizarre manifestation of things.
I want to flesh out the autogynephilia for a second because here's something that seems really bizarre to me. And there's so many things in the social justice movement, and this is a big one, where it's like we only accept it because it's left wing coded.
Yeah,
Right. So
I know.
imagine let's imagine like an alternate reality where you hear a story. There's a bunch of MAGA supporting white men who have this sexual fetish where they need to barge into women's spaces. Like, how acceptable would that be? Does that make sense?
Oh, of course. And I mean, where I thought you were going to go with that, which I think is equally interesting, is like, and I'm sure you've seen this when you were in school, like this whole sex positivity movement, which is very left coded, has really flung the doors open for, you know, destigmatizing everything, including, I mean, almost like objectively abusive BDSM situations or whatever, as long as consent is discussed. So there's all this weird stuff. But then you take autogynephilia, but like you're not allowed to accept or talk about that. It's not real. It's totally BS. Like that's what's so weird about it. Like the concept of autogynephilia is completely rejected by left-leaning psychologists, therapists, sexologists, all the gender affirming people like don't believe that it's real. So that's very interesting too. It's like, why is it that certain weirdo sexual things are okay, but other weird sexual things are not okay?
That brought the sex positivity brought something up for me. I was taking a marriage and family counseling class, and one of the books we had to read was The Ethical Slut, which is just kind of like polyamory
I
is a
have
good
not
thing.
read it.
Yeah, it's exactly
The
what you think.
title tells me enough what
It's
I need
exactly
to
what you
know.
think it is. But one of the things we were talking about in class is like BDSM stuff, and
Mm,
the answer is always affirm, no matter what, no questions. There's nothing underneath it. And I said, okay, like I'm a man here. I understand how ignorant I am, but what if it's a woman who's like sexually aroused by being humiliated during sex? You're telling me there's nothing underneath that? And the
yeah.
answer was absolutely not, only affirm. And I'm just like, yeah.
I'm so sorry that you went to school when you did. That sounds so like such torturous brain rot. I mean, I don't even know what to say about that.
It helps me to connect with sane people. This is mental health for me
Okay.
right now.
Yeah. Well, I mean, what is it that you want to flush out with autogynephilia? I mean,
I mean,
maybe we can just start with what it is, or
yeah, because I feel like it's trans really isn't one thing in a sense, because we've got it's weird how you've got a lot of the movement driven by middle-aged men with a sexual fetish pushing for medicalization of young teenage autistic girls. Like, does that seem like a disconnect to you?
Yeah. I mean, first of all, it's really interesting because autogynephilia aside, what I've witnessed in my work, which by the way, like with these nearly 1,000 consults I've done, it's interesting. The breakdown kind of falls in line with what we're seeing culturally, which is about 75% of them have daughters and about 25% of them have sons. And sometimes it goes up or down, maybe 30-70. But I raise this because the males who are interested in transition really want the drugs. They want to transform their physiological body. And the girls who seek out transition want to be validated. So these are two different things. So I think you're totally right to point out like autogynephilia is a different phenomenon than like a 14-year-old autistic girl. So men and women are different. Even if they identify with some other gender, like we still see these sex-based differences in the population. So and again, when I talked about like the history of gender medicine, it is for a long time been males who have this desire to transform their physiological selves driving the way this medical kind of process looks. And in order to, I think, make themselves feel more valid, it's a helpful story to say, well, I was always really a girl. And if I was always really a girl, then that means when I was 8, had I had these medical interventions that would have helped me be more authentic. And so therefore we have to give it to all the kids. Now, as I said earlier, as a therapist, I think all iterations are possible. I think there are some really nefarious and ugly motivators in that statement as well. And for some people, it might be more benign. It's not a new thing for middle-aged males who actually are kind of gender typical to want to transform themselves into women. Now, it's probably not talked about. And I think, nowadays, because gender is just so in the air that we are all kind of breathing in, I think a lot of males who might have had a tiny molecule of that feeling are now latching onto the trans idea. So, I've seen in my practice that there are boys who there's something sexually arousing. Maybe they're like 15 or 16 and a lot of them, it's interesting. They're looking at these like sexy anime characters that are like these sexy girl anime characters, and they start to kind of fall in love with the idea of them. And then they, you know, for some reason or another, will stumble into trans content. Then they'll like order a bra on Amazon and put it on, take pictures. And I mean, there's something kind of sexy about it to them. But, they wouldn't have been full blown autogynephiles, I think, in a different generation. But because this is so normalized, I think they take this little sexual molecule of curiosity and kind of go full force with it.
What role do you think pornography plays?
I don't know. I think it plays a role in insofar as like kids come across it very young, and I think it can have an impact on their ideas about their body and about sex with other people. I think it plays a role. It's a big debate. A lot of the kind of sexologist researchers, especially the men, don't think that porn can change your sexual proclivities. They think that we just are drawn to whatever porn already matched up with our sexual proclivities. And I think it's interesting. A lot of the women in the debate say, no, no, I think porn can actually shape how you develop. I'm not 100% sure, but I do think that if it's not dealt with carefully, it can really derail someone's development.
So, we've talked about a few things. We've talked about this internal chaos and turmoil and the typical angst of a teenager, how they get on social media and kind of this, I guess, social contagion would be a word you use. And it kind of spirals out of control. And then someone like you comes in with like ROGD treatment. Tell me what that looks like on your end.
Well, it's a juice, it's an extract, and you just take, one chug a day. I would say it's a treatment per se.
Sorry.
It's okay. No, I'm just laughing because it just sounds funny. I mean, so funny enough, what I do really is like, I would say 90% of what I do is I am trying to help the parents help their kid. I have come to believe that kids under the age of 16, it's almost like not a waste, but it's so much more effective to work with the parents than it is with the kids. Because the parents are the ones who are there with them every single day. And they are the ones that have a relationship to develop. And they are the ones who know and love their kid best. So I do work with individual kids on my caseload, but a lot of what I'm doing is also making suggestions to parents. I'm like, okay, I will work with your kid in individual therapy, but there's a lot that you have to do yourself to mitigate unhelpful influences, lean in with a lot of love, try to spark up these powerful conversations with your kid. So it's not magic. It's very, very basic, like parenting 101 stuff and therapy 101. So what I do with kids is, I tell them from the outset that I think this idea of questioning your identity and gender is very, very interesting. We're going to talk about it in a great deal of depth, but I'm not like other therapists that you might have read about on Discord, because I'm not just going to go through a checklist with you and then thumbs you up for a surgical procedure. Like, that's not my job. Our job together is to explore this really thoroughly and respectfully, but like sometimes in ways that are kind of challenging. And my job is to help you understand yourself better so that you can make good decisions for yourself when you're older, when you're an adult. So in my practice, I don't write letters for surgery. I don't write letters for hormones. And most families who contact me, they're not going to approve those things either. So my practice is like a place for exploration and trying to understand yourself better, and sometimes kind of challenging these ideas around gender. And in terms of like what the families do, so many parents have helped, if they catch things young enough and the kids are still at home. So many parents have helped their kids get out of this. And it's not magic. It's just almost like very basic parenting stuff. And you have to be aware of what's going on in the culture. And parents do need to educate themselves a little bit on this gender stuff so that they can have thoughtful conversations with their kids. but it is not impossible once a kid falls down this rabbit hole, it's not impossible to get them out.
What kind of response do you get from the kids? Are some of them like angry at you? What's their reaction?
Well, I mean, I've had lots of kids kind of come and go from my caseload over the years. The kids that I work with now, I've known for a long time, so they know me quite well, and I don't think any of them would be surprised about anything that I say. At the outset, when I was onboarding new clients, I would always have an initial conversation with them over the phone for like 30 minutes. And I would tell them, look, your parents contacted me, but this is going to be our therapy. So you have to decide if this is a good fit or not. And I'm lucky to say I've never had a kid outright say, no, I don't want to work with you. I think the landscape has changed a lot. It's entirely possible that a kid today who's like really a TikTok generation kid who's super indoctrinated, if their parents tried to contact me and they are like super social justice, there's no way they would work with me now. So the things have changed a lot over the years. But at the time when I started my practice, I was the only, as far as I know, I was the only therapist in the US saying explicitly that we should not be just affirming gender.
What year was that?
2016.
Wow. So you were like really early on. It's bizarre to me because I mean, I guess I was just not living in this world, but really it was not until 2020. A, I went back to school. B, COVID happened. And
Mm,
so that shook up a lot of things.
yeah.
But, the idea that you were like on the front lines back in 2016, like I wasn't even alerted to these issues
Yeah.
until much later.
Yeah. I mean, I myself, as an observer, started to pick this up early. I mean, maybe I could tell you like how that happened, but I was following the early parent blogs in 2015, which was Fourth Wave Now, which like nowadays there's millions of these parent blogs, but back then that was the only one in the US. And then there was Transgender Trend in the UK. And these were parents reporting my kid out of the blue said that they're trans. I said, okay, let's just go to a psychologist and see how they can help you. I was told to affirm, like all this stuff very early on. And it was a complete desert out there at the time. These poor parents had nothing. They just felt in their gut something doesn't feel right about this, but there's nobody talking about it in the public. So they were really lost. It was really a hard time for these parents. But, this came on my radar because I was working in a middle school. I started there in 2015. And there were some kids that I knew that had never mentioned anything about gender. And like a year after starting there, all of a sudden, a girl said, I don't think I'm a girl anymore. And I think I need to get a breast binder. And I already had established a relationship with her. And I was like, where is this coming from? Meanwhile, I had been reading those parent blogs. So I kind of put two and two together and started to see it both online and in my practice. So I was on the kind of early side of noticing that this was happening. And I remember, seeing the Gender Revolution edition of National Geographic, where there was this little boy with pink hair on the front. And he was like a trans kid, and Jazz Jennings in 2015. So this stuff was starting to happen in the culture, and I had my eye on it very, very early. And I guess from early on, I said, there's something wrong with this. Like, this is many of these kids, especially the little boys, like the Jazz Jennings of the world, they are definitely would-be gay men who got transitioned as
Yeah.
kids. But then the ROGD girls are more variable in their sexual orientation. So it's not all trans and gay kids, but that's definitely a chunk of it. So yeah, I mean, that's what I mean. Like, if you are not, as a therapist, if you are a normie, so to speak, and you're not like deep in this rabbit hole, you would have no idea how twisted all of this is.
That's, I brought up earlier, we talked about how this is like accepted because it's left wing coded. I mean, can you imagine a world where, the report goes something like this: a bunch of MAGA supporting men are uncomfortable that their effeminate sons are not masculine. And so they're chemically castrating them.
Yeah,
Like, how
totally.
would that be
Totally.
received?
Yeah. Yeah,
There would be, I mean, we tear this country apart if that was going on.
I know.
But because, oh, this is progressive. Okay.
Yeah. Well, I mean, one thing that I think liberals are really good at is branding. And so when you think about the terms that we are using, gender affirming care, that sounds so nice. Like, who doesn't like affirming things
And
and
care.
people? right? Care, it's care. But I mean, the way you said, uncomfortable with their gay sons, two sides of the same coin. We're talking about the same thing. And in fact, I've done some coverage on my channel about this Kai Shipley character, who's a child in Texas who was a very effeminate young boy. And he grew up in a really conservative, kind of church loving Texas community. And the mom, who is now since transitioned him and is now like a super proud supporter of her trans daughter, in the interviews, she acknowledges, like, well, when he was a boy, like, he was so feminine. We just fought, and I tried to beat him and make him, more masculine. It couldn't be done. And eventually I just accepted he was a girl. Like, what? Like, that's exactly what you're talking about. But the way she framed it is not, it's no longer, I hate his femininity. It's like, I've accepted his femininity, i.e., he's a girl now. So it's an amazing branding
Oh,
distinction.
yeah. Oh, man. This is like, it should be like marketer of the year. It's just trans.
Yeah.
So I've heard people like Nia Hughes and Michael Schellenberger say that the trans thing is the greatest medical scandal in human history. Should there be consequences for the people who push this?
Yeah, I think there should. I think there should, particularly because these are kids. These are kids. And we have no good, I mean, it's even weird to say there's no good evidence for it. Like, we shouldn't need papers to tell us that cutting kids' body parts off is a bad idea. I don't need a paper to tell me that. I don't care what evidence people put in front of me. I'm not okay with that. If an adult wants to do it as a cosmetic intervention, being very sober and grounded and knowing what they're getting into, that's a different thing. But to impose this on children is wrong. I do think there should be consequences. Luckily for me, I don't envy anybody who's in law or government, or I have no idea how to dole these things out, because the practice just kind of, it's almost like you're getting flooded and the water's just rising and rising, and before you know it, all your furniture is floating around your house. Like, this has happened, I don't want to say slowly, because it's not slowly, but I just think it's been in the water and it's become so normalized that I think a lot of people are just almost like in a sleepy daze doing this to kids and not really paying attention to what the hell they're doing. So I don't know how we dole out consequences for this. I mean, in the US, there are lawsuits, and I think one by one, people are going to be held accountable. And then I think eventually clinicians will be really scared. And unless they are a real gender zealot, they won't touch this with a 10-foot pole. Like, I think people used to be scared not to affirm. Like when I told you earlier about we're trained to affirm, that's fear. That is a therapist who's afraid of saying a bigoted transphobic thing. But I'm imagining maybe on the other side of this, there will be a new wave of fear of like, no, I don't want to work with these gender patients because they could detransition and sue us. So, I don't know. I don't know how to punish people who've done this to kids, but I do think there needs to be consequences.
You have an incredible up close look at the psychology of the trans issue. What are you seeing in the rest of the social justice movement more broadly?
That's a good question. I don't know. I don't know what's happening with the rest of the social justice movement. I mean, as I said, I work with a small caseload of kids who have been in my practice for some time. They've matured with me. They're a little bit older. They're a little more grounded. So I'm not seeing a lot of kids coming into my practice brand new. So, I mean, I'm hearing from a lot of parents, but there are different social justice trends that come and go. Like, more recently, it's the Israel-Palestine thing. That seems to be a trend in the social justice world. I'm not hearing as much stuff about racism right now. Like the 2020 George Floyd thing really brought that issue to the forefront. So I don't know. I'm not sure if I answered your
No, no,
question.
no, no worries, no worries. So we talked a little bit, quite a bit about your perspective as a therapist. And, this kind of gender affirming care is like a microcosm of like affirming care generally, of like the customer's always right model. How do we fix the therapy profession?
It's an easy question. Just like a little
Well,
question.
I thought you a softball.
Okay. Well, I mean, I think one of the big problems that we have, obviously, I think you can speak to this better than I can. The training that therapists are getting is pretty dismal. I don't know if we can fix the therapy profession if the education therapists are getting so terrible. And I think that's very, very sad. I think we need to bring back a genuine depth of thinking and a curiosity. I mean, for all of the criticisms that Freud and Jung and all these like old dead white men or whatever get, they were grappling with some very deep, interesting ideas. Even if we want to critique them, like let's critique them, but let's not just tear down the things we don't like. Let's build upon and let's expand these very fascinating ideas. I think there's also a lack of a conception of human nature. I mean, the critical social justice lens that has been applied to all these therapy professions and therapy schools is so devoid of depth and like of a common human experience. I heard you talking with Gabrielle Turner, and you guys were talking about how this worldview kind of makes it seem as though every category of person has a completely different set of rules that apply to them. So I think like part of the way we fix the therapy profession is, can we get back to the idea that there is a human nature and it doesn't have to be just one version of it according to, like privileged cis white people, but like, is there a human nature and are there commonalities that we all share, and how can we think about what that means and how to make therapy meaningful around those concepts? Like, I just think there's no grounded sense of like, who is a human being and what do we need to be happy and well? Like that seems like a basic question that doesn't seem to be even answered anymore in therapy training. Do you feel like that? Because I mean, you talk a lot about your experience in school.
Yeah, I mean, I mean, I have a lot of feelings around therapy training, but I think, for one thing, when you get into Jung and Freud and Adler and Ellis and all these people, a lot of the times you would hear someone just say white man, and that's like a self-contained argument for why this person's wrong. Like no other
Yeah.
explanation is necessary. Like
Yeah.
that refutes all their work in and of itself.
Yeah.
So that's part of it. I think a lot of my criticism of grad school is it's basically like an adult daycare. I mean, like, I never once learned CBT, not at all, other than kind of offhanded comments of like CBTs for white men. I never once learned anything about CBT, but I spent hours playing with Play-Doh and coloring with markers and stickers.
I saw your post about that. It was just
It's embarrassing.
unbelievable.
It's embarrassing. Like I was so proud to go to grad school, and I don't tell people, like I'm embarrassed.
Yeah.
So that's part of it. I wanted to say one thing about what you're saying about human nature. There's a Japanese saying, I think it's Japanese. In some ways, you're like every other person. In some ways, you're only like some people. And in some ways, you alone are like an individual. And I think, what a
Mm,
lot of social justice has done is like this universal and individual, you get rid of
wow.
those and only narrow it down to the group perspective. And it's
Yeah.
so limiting and reductionistic. It takes away so much of the picture.
I love that so much. I think that's so powerful because I always say there's a grain of truth in all of these weird perspectives. Like, of course, there are some ways in which, because you are a man of a certain age and I'm a woman of a certain age from a certain background, of course, we may not be able to understand each other in some ways. But of course, in other ways, we share like this common experience. So I love that quote. I'd like to find it. I think that's a very good point. As a therapist, like if you believe that you can't possibly connect with the person sitting across from you in a therapy session, how in the world can you help them other than through political dogma? You know? So it's sad, but I think it leaves us bereft of tools and possibilities to help our patients or clients.
There's this idea where it's like you come from a different category than me, therefore I could never possibly understand you.
Yeah.
However, I need to devote my entire life to trying to understand you with the knowledge that it's never going to happen. It's kind of this
Yeah.
bizarre paradox.
Yeah, totally. And with maybe a layer of guilt on top of it because
Yes.
you
Yeah.
can't,
Yeah.
you're trying to understand someone and you can't, and you should feel bad about that for some reason or another. It's very
Your
strange.
your privilege has blinded you.
Yeah.
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 I have one final question, and that is when you look at society more broadly, what is one issue that we're not talking about enough that we should be talking about more?
Oh man. Well, I live in a bit of a bubble, so I'm not so sure how helpful I could be about society more broadly. Well, okay. I mean, I feel very, very strongly about the value of physical strength. So I'm someone who weight trains, and I think, again, I see things as metaphors. And I just think if a person who's having mental health difficulties builds a practice of doing something difficult that you can progressively measure and improve upon, that in and of itself is such a powerful metaphor for your sense of capability and your confidence. And I think young people these days, and maybe even not young people, really lack the ability to kind of track their progress over time. And I think strength training is one of the few ways in life where, like, you can't fool yourself. You
Mm.
can't lie to yourself about it. A number is a number. You either did the lift or you didn't. And I just think it's such a powerful way of, like, building discipline and, like, seeing yourself improve and being grounded in reality, for lack of a better term.
Correct me if I'm wrong. My memory could be bad on this one. Did you set a personal record deadlifting recently?
Yeah, it was a couple months back. Yeah, it was a 315 deadlift.
That's very impressive. So
Thank you.
I've talked about this weightlifting issue with a number of men on here. It's good to have like a woman's perspective as well. But to me, it's like I don't know how this is going to come across, but like there's something about as a man to feel competent and capable and confident. Like if there's a woman in distress who needs a heavy box picked
Yeah,
up, I can
yeah,
come in there and save the
yeah,
day. And
yeah,
that sounds silly, and it might not make sense. I went through like chronic severe depression for a number of years, and exercise is one of the big things that got me out of it. Just
yeah,
you feel capable. I don't know how to describe the feeling,
yeah.
but it's like I feel like so much of depression is tied to feeling weak, and just being able to feel strong is the opposite of that in some ways.
Yeah, and I think depression is tied to feelings of helplessness and
Mm.
hopelessness. And when you feel capable, I mean, I'm also thinking a little bit about Richard Reeves, the guy who wrote this book about, like, he talks about boys, and I'm trying to remember the name of the book, but he basically is a journalist who's studied some of the changes in the gender dynamics and how boys and men are feeling very not needed in
Mm.
society. And I think about, of course, even though I can lift relatively heavy for a woman, the power differential between a man and a woman is always massive. So even as a strong woman, like, there would be things in my life where, like, I would need a man to help me with these things, so to speak. So I do think, being able to also just, like, possess yourself and feel capable and powerful in yourself. And men obviously have a much greater potential for strength building than women. If I always kind of joke with my husband, if I were you, I'd be like deadlifting like 800 pounds. I'm not. But yeah, I think that's a very powerful way of building your capacity and recognizing how, you're built to be strong. I mean, men are built to be strong.
It's almost kind of a metaphor for like empowering therapy versus the social justice narrative of victimhood, where it's like you can kind of take your fate into your own hands, lift these things, empower yourself, versus there's no point because all of the issues are systemic and structural.
Totally. Totally.
It really is a good metaphor. It reminds me, this is way off track. There was an article that I found about a woman on MSNBC who said that working out was tied to right wing white supremacy. Because like this whole, it's rooted in personal responsibility and,
Yeah.
owning
Yeah.
this, empowering
Yeah.
yourself, that's
Yeah.
bizarre that like working out has become right wing coded.
Yeah. I remember hearing some kind of hullabaloo about that, which is just, and it also just goes to show, like, if you have a worldview that prioritizes and glorifies being submissive or something, like, it's weird because it's an aggressive posture to, like, make fun of people who work out. But at the same time, like, she's demonstrating my worldview thinks that strength and taking responsibility for your health is a bad thing, and you should actually value all the ways that you were oppressed and limit your capabilities. That's an insane, I mean, it's totally an insane
It's a
thing
psychotic
to,
worldview.
yeah, it's
It's
totally,
oh,
so it's so self-defeating. I feel really bad. Like, I feel really bad for people who are stuck in that. Like, wow, what a way to make your locus of control totally not in your, locus of control.
yeah, yeah,
Yeah.
absolutely.
Well, this
Well,
was fun.
yes, Sasha, thank you so much for joining me. I really enjoyed this conversation. Would love to talk to you again sometime.
Me too. Thank you so much, Ryan.